Hi everyone. So these are the last few of the school-age child and family from when we got interrupted from the power outage, which apparently is continuing on through the weekend at Algonquin. So good thing we called it sooner rather than later and got to leave a little early on a Friday afternoon. So and the folks in residence have their power, so yay. Anyway, I'll quickly review back through some of those slides that have the blanks so that you can see them on the video. So there's the general characteristics with the Erikson, Freud, Piaget things, which are getting mentioned every lecture over and over again. So I'm thinking those might be excellent things to make note of and to use as a framework when you're studying, to make comparisons through the age groups. What do those mean? Maybe look up their Wikipedia pages for those and have a different understanding than what the textbook is telling you. And really think about what those Erikson and Piaget different things mean and how that manifests at different ages for kids as they're going through, and then making even that extension to what that means in the healthcare environment, which we'll talk about more on the last day. So there's that slide, as well as the physical growth. I understand has a number of blanks on there, like gaps in one's primary teeth set, of which there are 20, of which you will have 32 when you're done, even though people get their wisdom teeth removed. And not those ones. You might be able to see the Tanner stages better on the video, but we'll have better slides, even better next week. I think this one had some blanks on it as well. I will bring in some resources for sex ed materials that make things easier for kids at different ages and stages so that you can see some of the ideas that I've been talking about. Nursing tips was directly out of the textbook. This one might have had a blank. Oh, no, it's not on my list. School-related tasks had some, I'm pretty sure. Remember, yours looks a little different because it has those nursing tips included, which I moved to a different slide because they were relevant to different material. Piaget, concept of conservation, Jen switching letters around. I won't talk about conversation this time. Might be able to see this better on the video as well than in class. Okay, and Kohlberg. I think these ones were good. Now these are going to launch into the notes on the different age groups, the 6-year-old, the 7-year-old, the 8-year-old, the 9-year-old. Of course, now that you'll have these slides on video, you'll be able to pause them and just fill it out and see what it is. But I really encourage you to challenge yourself to, before you fill it out according to what's on this PowerPoint slide, go through and just take notes for yourself. Think of things like, what are key traits for this age group? What's their vocabulary size? What amount of sleep do they need? What are some key health and nursing tips that that section is pulling out? And then compare to these slides to see if your notes match that. So really try the self-study option, because really getting less on your PowerPoints, even though it means more work for you, means that it's actually forcing you or encouraging you to consolidate that information for yourself. Because just being given the information means you don't actually learn it, you just kind of know it for the test and then dump it, and then you don't have it on board when you need it for doing your exams at the end of 4th year, or for doing your licensing exam, or worst case scenario when you need it in the workforce and you have to start learning everything over from scratch. So I encourage you to start that process now. So anyway, at any rate, here are the slides. There you go. 6-year-old, you can pause and look at these as you need to. 7-year-old, table 19-3, it's awesome. 8-year-old, 9-year-old, preadolescence, 10-year-old, Preadolescence, 11, 12-year-old. The importance of play. This is still focusing on sections from the book, and then this one I'm pretty sure has some blanks on it. Alright, so 5 minutes of that, and then so concerns related to normal growth and development. So in terms of the school experience is really second only to the family in terms of a socializing agent. Like, this is the two big places where kids are learning how to act and behave around other people. Sports is another one, but remember, sports is something that's typically available to people who have access to all sorts of resources. So not everybody has access to that, whereas kids are expected to be cared for by somebody and be attending school. So at minimum, they have those two things to access. So it's where they really are transmitted the values in society, and peer relationships are a huge part of that, and they're going to become increasingly a part of that because the older you get, the more independent you become. So teachers are a key authority figure, as included in that reading from the novel that I did by campfire light by my phone in the power outage. I really appreciate that section of that novel, not only because it has a healthcare issue, how a 9-year-old's coming to grapple with this idea that her older brother has a mental illness, but also how she's thinking of her parents as authority figures, how she thinks of her teacher as an authority figure, and how she's socializing and interacting with her classmates socially as well. It's just such a crux at that age and stage of being a little kid and moving towards independence. And that sort of 9-10 bridge is just such a key little age, and so much fun to watch with kids that are really have the advantage to get the most out of being at that age. So they respond really well to teachers who possess characteristics of warmth, like a loving parent. Teachers in the early grades perform many of the activities that the parent had assumed as they're gently guiding kids towards independence, such as recognizing kids' personal needs, like socializing them to be aware of their bodies and using the bathroom and needing help with clothing. So when a kid comes into hospital and parents aren't around to be doing those things, then the expectation is the person who's at the bedside the most, and that's going to be the nurse. So that's going to be you guys if you choose to work at CHIO. Helping to develop social behaviors, so that includes things like, the example I used of turning the television off when the nurses come in to do vital signs or talk to parents and things like that. Expecting pleases and thank yous. Even though somebody's not feeling well, you can still be polite. This is my work environment. I know you have to live here, but I expect you to use please and thank you, and you should expect me to use please and thank you when I'm working with you as well. And then follow up on that, do that. Lead by example in doing that with not only the children, but your colleagues and your other staff and visitors that you're working with. So teachers in the school environment also serve as models that children often try and emulate or idolize, and they seek their teacher's approval and avoid their disapproval. So the teacher is really a significant person in the life of early childhood and even into sort of pre-adolescence and adolescence for kids who are really connected with the school environment. So parents also are sharing the responsibility, obviously, for helping children develop innate capabilities and social awareness. Have a look at that family-centered care box in your chapter. Cultivating responsibility is one goal of parental assistance, sort of being expecting kids to be responsible for schoolwork, helping them to learn to keep promises, meet deadlines, that kind of thing. All of those things they're going to need as skills for working in school projects when they're older, in group projects, and then later when they're doing that in their jobs. So All of those foundational skills get laid down in early childhood years as you're learning to work your way through a school environment, structured school environment. And so, yeah, just carry on from there. Is there any other things? Latchkey children might be a sort of older term that you're not familiar with. Latchkey kids are kids who come home from school and don't go to a babysitter necessarily. Maybe they're 11, 12 years old and are old enough to be home alone on their own for a couple hours before mom and dad or parents get home from work, parents or other caregivers. So it's an important part of growing independence. But it can be a lot of stress for those kids because a couple hours on your own can be a lot. Also a lot of temptations in terms of not getting homework done, but lazing about in front of the TV or playing video games or whatever. So again, it's that opportunity for parents to develop limit setting and discipline, have expectations for those kids, and that can be supported by health practitioners in primary care settings, such as nurses, when they come in for a visit. Is my kid old enough and responsible enough to do that? What kind of things do those kids need to know? They need to know how to call 911. They need to know their address and phone number, which young school-age children should know. They should know their parents' full names, not just their last names. Like some kids kind of clue out on what their parents' full name is because they don't call them anything else but mom or dad. What to do in an emergency, what neighbors they can trust to go and knock on the door, who's actually going to be home at those same time as the day as they are, who else they should be able to call and get access to easily. Are mom and dad available, or will mom and dad be driving and their cell phone won't pick up? So all of those things are things to consider for kids that are learning to stay home alone for the first time. All right. So promoting optimal health during the school year in terms of nutrition. So the next few slides are going to talk about nutrition, dental health, sleep and rest, exercise activity, importance of sport and acquisition of skills. So in terms of nutrition, so kids are developing their habits at this stage. A lot of these things that they learn at that age are going to be lifelong skills that they're going to use, and parents have huge influence, and primary caregivers have huge influence on this kind of stuff. For example, I can remember going on a sports team with a particular family who, after the sports event, would always stop and buy Coke and chips after sports. And the notion was like, you'd just spent 2 hours at practice, like you totally deserve that. And it's been such a head wrecker to try and get out of that mentality of like, doing a fun winter activity for a couple hours should end in salty and sugary drinks, and a salty snack and sugary drinks. And it's real habit forming, like it's almost ingrained. So I wish in some respects that they had orange slices or something. I'd associated that with healthier snacks, because after a day of skiing now, I often think like, man, I could really use a Coke and a bag of chips. And I know this is a holdover from when I was 9 to 12 years old and going to events with these folks. It really gets laid down in those ages. So the other biggie is spending of their own money, and thinking through making smart choices in terms of their own money and spending on snacks and things. So obesity tends to become a problem in this age group. Partly that's physiological because they're going through growth spurts. But that period where their body is just holding on to every calorie they eat in anticipation of a growth spurt can kind of get ahead of itself if they then don't have as gigantic a growth spurt as they've put down the energy for, laid down the fat for, so they can end up at the end having taken in more calories than they're going to grow into. So common nutritional concerns at this age also include childhood hunger, whether that's due to poverty at home or food insecurity, also risks for, which create risks for health problems, as well as just socialization in terms of controlling their own diet now as they go to school and can, you know, throw away whatever part of their lunch they're not interested in. As they're seeking to gain more control over their lives, if they're not gaining independence, then that can sometimes lead to more disordered eating patterns as they get older, as well as overweight and obesity, as well as watching for, you know, boredom and comfort eating in this age group as well. That those habits then can also be habits of, you know, if kids are given something yummy to eat as to placate them if they've been upset for some reason, then that can also lead to disordered eating habits in the future. So heads up on that, which is another huge topic. And remember, this is a survey course, so those are awesome ideas to think of in terms of term papers if you have to write something for mental health in the future, or other types of med-surg topics that might have things on obesity and bariatric care for folks who are, which is care of people who are greatly overweight. So common nutritional concerns continued here include food safety and handling. So ensuring that kids are using kitchen stuff safely, especially if they're those kids who are home fixing snacks for themselves after school without parental supervision, that they're not using parts of the kitchen that they shouldn't be getting into. Common dietary deficiencies could include allergies or immune responses, either, or allergies rather, picking up in this age group. You can develop an allergy throughout your life that you didn't have before, or other deficiencies might include things that are related to growth, so not getting enough of individual nutrients that then affect growth. What else? Just to point out here, the difference between a food intolerance is an intolerance is gastrointestinal upset, whereas an allergy is a full-on immune response. And there's some common allergies there. Also common intolerances on that list to some degree as well. This is the sequence of eruption of the secondary teeth when they're expected to come in. I can automatically guess that based on previous questions that someone's going to ask, do I need to memorize that? You need to have a good idea when these things come in, but look, they come in a pattern. So the youngest ones are the ones that are central. It's like that development in infancy and toddlerhood where stuff starts centrally and moves more peripherally. So which ones come earlier? The incisors, and then it moves outward towards the molars, and they come in later. And then here again, starting at the incisors and moving outwards toward the molars. These ones come in earlier and these ones come in later. So have a good idea of it, but like, do you have to memorize it? I would imagine that you'd be able to have a good idea of where this range starts and where this range stops, and be able to, at the very least on a multiple choice exam, eliminate 2 out of the 4 answers and then have yourself down to a 50-50 guess on the answer, versus swimming and looking at all 4 and going, oh no, I don't know the precise numbers. If that doesn't make, that explanation doesn't make sense, email me and say, Jen, I don't understand your multiple choice example, but so in terms of sleep to rest, they average around 10 to 13 hours of sleep per night, still from age 5 up to 10 years. This can be really individualized. They're going to resist going to bed. If they're offered the opportunity of screens before bed, then this is going to get chipped away at like crazy. Screens keep you awake. The blue light that's emitted from screens, whether it's television, iPad, computer screens, or phones, it keeps people awake. It's a type of light that your brain then just doesn't start releasing the right hormones to help you wind down and go to sleep. So parents need to be encouraged to limit screen time for a couple hours before bed. Encourage book reading and quiet time before bed. Because the other thing are endorphins, which are brought up by running around and racing around before bed. And older kids can more easily be encouraged. 8 to 11-year-olds are still just really want to be, there's that feeling of being left out of something that they're really attached to. So that can be a very difficult age in terms of establishing routines. So if there can be some way to incorporate storytelling that involves a bedtime routine that involves everybody kind of working together, then it can sometimes ameliorate that I'm being left out feeling. Exercise and activity. So sports can be very important. There's a lot of sports that limit contact sport in this age group because the bone ends have not fully fused because there's growth plates, and so traumatic injury at this age can have more long-lasting effects if there's breaks at the bone ends. As well, a number of leagues like the Timbit Hockey League and that kind of thing limit the competitive nature, even though the kids still keep track of the score. There's no official scorekeeping. It's more like everybody gets a chance to play and everybody's out having fun and learning skills versus keeping a tally of the score, which is both good and bad. It's important to learn to be a good sport and to lose with dignity and letting everybody know that you had a good time and enjoyed the game, and also win as a good sport and not rub other people's noses in it, which is something that kids, especially in the sort of 7, 8, 9-year-old range, can often find very challenging, that they've had this success and they want to let other people know about it, but don't necessarily do it in a way that's super thoughtful and feeling. So it's a huge learning curve, and it's very important environment for them to get that guidance from adults and hopefully have it role modeled positively. Although we know in some sports that doesn't get role modeled super positively by parents on the sidelines. And that's a lot of where the emotional maturity comes in a competitive environment. So my personal opinion is that the competitive environment promotes some of that emotional maturity, but it really is affected by the role modeling aspect of the coaches, the adolescents on any teams or involved with any teams or in a mixed club environment, because that's where the kids are looking to for their role modeling. And then because competition and team playing can be such a new challenge, or even involvement in individualized sports. So even if, like swim club, for example, there's still a lot of integration and team play that occurs even in practices, even though you're swimming independently and doing your own thing, as an example, you're still judging where you are in the lane with the other people and determining if you need to pass and letting other people pass if they're doing that skill faster than you, etc. So it's not, it's even though it's an individual sport, it's still not so individualized that you're not having some of that same team playing aspect coming through. So here's some examples, some more casual kind of play activities that can be integrated that aren't so structured as sporting activities. And then of course there's a Also the playtime that's individual. So, you know, whether it's, you know, building things with Lego toys and things that don't necessarily have to follow a plan. Like, just use all your Legos and do something creative with it, versus following whatever's on the box, for example. It's a really important encouragement that they don't have to follow what the rules are. But if that's what they want to do, then knock yourself out and do it. So safety is also a huge thing because of those, as I was saying, with the long bones growing so much and the growth plates are still not fused. Injury is important to protect for. So you'll notice this girl's bike helmet is down on her forehead. Often you see people sitting with their bike helmet coming across the crown of their head. That coronal suture that you have in the skull is called the coronal suture because corona is Latin for crown, and you know, your bike helmet should not be sitting on that. Oops. Whoa, computer. Your helmet should not be sitting across that coronal suture of your skull. It should be down across your brow, just like this girl's got. And this person, sorry, I can't tell if it's a girl or a boy, and they've got their straps on their helmet in a perfect V around their ear, which is great. Their chin strap is nice and snug. It looks a little too snug to me. I'd want to be able to get one finger in under there nice and comfortably. And the helmet is not so large that it's going to be tipping all over the place, but it's large enough that this foamy bit that comes down over your occipital ridge, so if you feel at the back of your head, you've got that little ridge, and this foamy part is going to match up fairly closely to that back there. So this is a perfect fit. The bike itself also fits so that they are just reaching the ground, so that their foot isn't flat, so it's going to be tall enough when they're pushing on the pedal that they've got a slight bend in the knee when the pedal is straight up and down, and but not so tall that they have to lean way off to the side and really push to get onto their balance to get going again. So this is an excellent example of a properly fitted bike and a properly fitted helmet. My computer's just a little stuck here. Okay. Social media, so benefits include entertainment, development of communication, technological skills. People are better readers these days just because of using type so much, even in the abbreviated forms, but risks also include lack of sleep, as I discussed, cyberbullying, because who are they talking to exactly, and how are other people using the environments that they're in, and contact with sexual predators, for sure, but also just people who are wielding power where they shouldn't be. So even if it's older people influencing younger kids online in ways that may not have a sexual nature, but also aren't respecting of boundaries, etc. That's an important precursor to then being susceptible to this kind of thing in the future. So kids need parental monitoring. Parents need to be on it in terms of participation and discussion with their kids' online activity, which again, a lot of parents are preoccupied with their own social media activity. So it used to be as simple as just putting the computer in the rec room, but now everybody carries or in the rec room or the office or the kitchen, somewhere where it was accessible to everybody, the living room rather, not the office, but accessible to everybody in the house so that you could keep tabs on it. But now everybody carries their computer in their pocket, so or on their lap, so it makes it a lot easier for kids to keep that privacy, where they may not be ready for the responsibility of that yet. School health, this is pretty self-explanatory. Injury prevention might include things like motor vehicle crashes. They're the most common cause of severe injury and death in school-age children, either as a pedestrian or as a passenger. Bike injuries, we talked about helmets and stuff. and safety equipment for all sports, and that includes not buying used helmets. Canadian safety standards are very clear on the idea that you shouldn't buy a secondhand helmet. You don't know where it's come from, as well as any other sort of regulated sporting equipment. You need to be very careful if you're buying it secondhand and get it checked out before you shell out the money for it, because it might not be safe. So common issues for school age, head injuries and concussions, which we've loosely talked about just in relation to helmets here, but concussions include a direct blow to the head or indirect blow to the body where the force is transmitted to the head, which a lot of people don't think about that as clearly as they should. So that includes a hard fall on your butt can lead to a head injury, which a lot of people don't think of. A hard fall to the side or being knocked hard in a tackle on the side can lead to a concussion because your brain is floating around in all that cerebral spinal fluid up there, and it can slosh about and smack into that skull pretty seriously with an indirect blow to the body. There's also stress fractures, which, just again about head injuries. The manifestations of concussion can be subtle and easily missed. And so any child who sustains a heavy blow to the head or body and might have a concussion needs to have a medical assessment. Like, there's no sitting on the sidelines and see if, they start feeling less groggy or whatever, and they won't necessarily pass out. You don't have to pass out or be knocked unconscious to have a concussion. And the treatment is cognitive and physical rest. And so stress fractures, they occur as a result of repeated muscle contractions. And on growing bones, there can be a risk. They're often seen in repetitive weight-bearing sports. So the classic one is gymnastics, where you're landing on your bare feet heavily from any of the equipment onto your feet. And of course, as we know, feet on school-age children grow like crazy. They often have these gigantic feet that they haven't grown into yet. And that repetitive weight-bearing and pounding that feet take in gymnastics and figure skating and other jumping, running, and skating sports can really create a risk for stress injuries. So the symptoms are sharp, persistent, progressive, or deep pain over the involved bony surface. And the diagnosis is based on clinical observation. Sometimes they do a bone scan. Often, if you take an x-ray, it just shows up as sort of a indiscriminate, cloudy area. So management is rest and alleviation of the repetitive stress that initiated the symptoms. So if you have a kid who's in a competitive sport, there could be resistance against that. Training with alternative exercise plans, physiotherapy, etc., and use of non-steroidal anti-inflammatory medications for discomfort, which probably shouldn't be encouraged to use necessarily the over-the-counter ones. That might be ones that are script ones so that they're less work on the liver and kidneys. But that's going to be individualized to the kid and how old they are, how well they're able to tolerate. Advil would be the over-the-counter non-steroidal, or ibuprofen. Advil and ibuprofen. Advil and ibuprofen are the same thing, I should say. So the nurse's role in sports for children and adolescents is to evaluation of their activities and to be thinking ahead of the game and preventing some of these injuries when they're telling you in your health assessment in a primary clinic or at GEO that these are some of the things that they're involved in. So if they say they like to bike a lot, then you ask if they have a bike helmet and when did they get it and have they outgrown it and how does it fit and etc. So altered growth and maturation. So again, the growth spurt thing often follows even a familial pattern. You can ask parents if they were late in their growth spurts or early in their growth spurts, or if they had 1 or 2 big ones, that kind of thing. People tend to know or remember if there was an unusual one, like they sprouted up early, or I, for example, spent all my summer money before my first year at university buying new clothes, and then I actually had a growth spurt at 18 years old, which is late for a girl, and all those clothes, like having a high pant leg was not in style at the time, and then I had these pants that were all like halfway up my calf because I had a growth spurt. Very frustrating because I did not have money to get new things. Anyway, so tall stature can be perceived as a social handicap among some kids. It tends to make kids less coordinated and stand out in things like school pictures, and especially if their teachers line them up or sit them in the classroom by height, then which apparently is still a thing. I didn't think it was, but then it, you always end up at the back of the class. And then there's perceptions about whether boys or girls are taller based on the fact that more men tend to be taller than women. But that isn't true necessarily in school age, because girls tend to have their growth spurts a little bit earlier, so then that short stature can be difficult for the boys and the tall stature is difficult for the girls. And short stature, again, it needs to be checked out if it's lingering for a while. Kids in school age years still need to be being put on a growth chart when they come in for doctor's visits. But the most common cause worldwide for short stature is inadequate nutrition, so you need to be checking out kids who have not been in for a doctor's or primary care visit, doctor, nurse practitioner visit for a long time, to see where their nutrition is at as well, whether they're normal on the growth curve or not. Other causes can be chronic disease, endocrine dysfunction, congenital defects and disorders, errors of metabolism. Yeah. So ADHD, so the diagnosis of this is based on screening tools that primary care providers use regularly, and as a nurse in a primary care office, you may be the one conducting the screening, so you get to know which tools you use specifically, but we can certainly ask our guest coming on the last day of classes what kind of screening tools she might use. In fact, I'm going to jot that down because I might ask her to bring in some examples. It also includes thorough evaluation, developmental and medical history, physical exam, and psychological testing to rule out any other causes that might not be attention deficit or hyperactivity. There's other things that create similar symptoms, but this is certainly the kind of number one cause of a number of the listening and attention disorders for kids in schools these days. Bedwetting, which we talked about in the last lecture as well. I won't go on about it here, but at this stage and age it's more common in boys, but also children who've undergone any major stressors recently, or kids who come into hospital because of that IV running, or because of medications they might be taking, or because of procedures they might have had, or because they might have had a Foley, for example, a Foley catheter used during a surgical procedure that then sort of their bladder isn't quite as responsive for the next 24 hours or so. And so a formal diagnosis of enuresis requires developmental age of more than 5 years. They're wetting the bed overnight, twice a week, or more for more than 3 months, and they may wake up with urgency, or may void frequently through the day. So for the management stuff, I talked about that back in the preschool one. School phobia, So this occurs in children of all ages, but it's most common in children 10 years of age and older. School avoidant behaviors occur in both boys and girls and in children from all socioeconomic levels. Anxiety that often verges on panic is a constant manifestation, and children can develop symptoms as a protective mechanism to keep them from facing the situation that distresses them. Physical symptoms are prominent and may affect any part of the body. For example, anorexia, so not wanting to eat, nausea, vomiting, diarrhea, dizziness, headache, leg pains, abdominal pains, or even a low-grade fever. A striking feature of school phobia is the prompt subsidence of symptoms when it is evident that the child can remain at home. Another significant observation is absence of symptoms on weekends and holidays unless they are related to other places such as Sunday schools or parties or other weekend activities. Occasional mild reluctance is not uncommon among school children, but if the fear continues for longer than a few days, it must be considered a serious problem. The onset of school phobia is usually sudden and precipitated by a school-related incident. By taking a careful history, nurses find out whether poor attendance record is caused by trivial reasons. So this is a super big reason that kids end up in the primary care office. So it's an important one to know about. So treatment for school phobia depends on the cause. Primary goal is to return the child to school. The longer a child is permitted to stay out of school, the more difficult it is for the child to re-enter. Parents must be convinced gently but firmly that immediate return is essential, and it's their responsibility to insist on school attendance. A school re-entry protocol may be necessary for a child with severe symptoms. On re-entry programs, the child role plays routines involved in getting ready for school that occur at school. Relaxation techniques are also used. The child usually goes to school initially for a half day, then progresses to a full day. Often a school nurse may be asked to provide support to the parents and the teacher during the re-entry process. If the problem persists, professional help is recommended. So it can often be related to some sort of social, academic, or physical. Those three areas are developing at different rates and stages. So if one just hasn't caught up and it's creating a huge amount of stress for kids, then often these sort of I feel sick kind of things start manifesting in little kids. So it's a good one to know about. And that's it. If you have any questions, you can email me, which I did not include on here, but I can. Well, you have it actually on Blackboard in the instructor information. So thank you, everyone. Have a good rest of your week.